Have you ever taken off your shoes after a long day and noticed that your ankles looked bigger than usual? Maybe your socks left deep marks around your legs, or your shoes suddenly felt tighter than they did in the morning. At first, you might ignore it, thinking it's just because you've been on your feet all day. But when ankle swelling keeps coming back or becomes more noticeable, it's natural to wonder if something more serious is going on. The truth is that ankle swelling is incredibly common. Millions of people experience it at some point in their lives. Sometimes it's completely harmless and goes away after a little rest. Other times, it can be your body's way of signaling that something isn't working as it should. In today's video, we'll explore the 8 most common causes of ankle swelling, explain why it happens, and help you understand when swelling is normal and when it's time to seek medical attention. Later in the video, we'll also discuss simple lifestyle changes and home remedies that may help reduce swelling and improve your overall health. Before we begin, remember that this video is for educational purposes only. It should never replace advice from your doctor or healthcare provider. If you experience severe swelling, chest pain, difficulty breathing, or sudden swelling in one leg, seek medical attention immediately. Now, let's begin by understanding what ankle swelling actually is. Ankle swelling occurs when excess fluid collects in the tissues around your feet and ankles. Doctors refer to this condition as edema. Our bodies constantly move fluids through blood vessels, tissues, and the lymphatic system. Normally, this fluid balance stays under control. But when too much fluid leaks into nearby tissues or your body struggles to remove it efficiently, swelling develops. Sometimes the swelling is barely noticeable. Other times, your ankles may become so swollen that your shoes no longer fit comfortably. The swelling may affect one ankle or both ankles. This difference often provides important clues about what's causing the problem. For example, swelling in just one ankle may happen after an injury, insect bite, or localized infection. Swelling in both ankles is more commonly linked to prolonged standing, certain medications, pregnancy, or medical conditions affecting the heart, kidneys, or liver. Besides swelling, some people may also notice tight or shiny skin, a feeling of heaviness in the legs, stiffness around the ankle, difficulty wearing normal shoes, sock marks that remain on the skin, mild discomfort after standing for long periods. Sometimes, pressing a finger into the swollen area leaves a temporary dent. This is called pitting edema and may help doctors identify the underlying cause. Now that we understand what ankle swelling is, let's look at the most common reasons it happens. One of the most common causes of ankle swelling has nothing to do with disease. It's simply gravity. When you stand for many hours, gravity pulls blood and fluid toward your feet and ankles. Your veins have to work harder to return that blood back to your heart. If you remain in the same position for too long, fluid begins collecting in the tissues of your lower legs. The same thing happens if you spend hours sitting at a desk, driving long distances, or traveling on an airplane. Office workers, teachers, factory employees, cashiers, healthcare workers, and retail staff commonly experience this type of swelling. Fortunately, this swelling usually improves after walking around, elevating your legs, or sleeping overnight. Although occasional swelling from prolonged standing is generally harmless, frequent swelling may indicate that your circulation isn't working as efficiently as it should. That's why regular movement is so important. Experts recommend standing up and walking for a few minutes every hour if you sit for long periods. Simple ankle circles and calf raises can also help improve blood flow. Cause number 2, eating too much salt. Many people don't realize how much sodium they consume each day. Even if you rarely add table salt to your meals, processed foods often contain surprisingly large amounts of sodium. Foods like chips, instant noodles, frozen meals, canned soups, fast food, processed meats, and salty snacks can all contribute. Sodium helps regulate the amount of water in your body. When you consume too much sodium, your body holds on to extra water to maintain the right balance. This extra fluid doesn't just stay in your bloodstream. Some of it leaks into surrounding tissues, leading to swelling in the ankles, feet, and sometimes even the hands. Many people notice puffiness after eating restaurant meals because restaurant food often contains significantly more sodium than homemade meals. The good news is that reducing sodium intake can make a noticeable difference for many people. Choosing fresh fruits, vegetables, lean proteins, and home-cooked meals instead of heavily processed foods can help your body maintain a healthier fluid balance. Staying well hydrated is also important because drinking enough water actually helps your kidneys remove excess sodium more effectively. # cause number 3. Ankle injuries. Not all ankle swelling comes from internal health problems. Sometimes the explanation is much simpler. A twisted ankle during exercise, stepping awkwardly off a curb, slipping on wet ground, or participating in sports can all damage the ligaments that support the ankle. When tissues become injured, your immune system immediately begins the healing process. Blood flow increases to the injured area, bringing oxygen, nutrients, and immune cells that repair damaged tissue. This healing response causes inflammation, which leads to swelling, warmth, pain, and sometimes bruising. Most mild ankle sprains improve with proper care over several days or weeks. Healthcare professionals often recommend the RICE method, rest the injured ankle. Apply ice for about 20 minutes several times a day during the first 2 days. Use compression with an elastic bandage if appropriate. Elevate your foot above heart level whenever possible. However, not every injury is a simple sprain. If you cannot put weight on your foot, hear a popping sound at the time of injury, notice severe deformity, or experience intense pain, you should seek medical evaluation because a fracture or more serious ligament injury may be present. Ignoring a serious injury can delay healing and increase the risk of long-term joint problems. Healthy veins contain tiny one-way valves that help move blood upward from your legs back to your heart. Over time, these valves can weaken. When that happens, blood begins pooling inside the veins instead of flowing efficiently upward. Doctors call this chronic venous insufficiency. As pressure builds inside the veins, fluid begins leaking into nearby tissues, causing swelling around the ankles. People with poor circulation may also notice aching or heavy legs, swelling that becomes worse by evening, varicose veins, skin discoloration around the ankles, itching near the lower legs. Slow healing skin ulcers in advanced cases. Several factors increase the risk of poor circulation. These include getting older, obesity, pregnancy, lack of physical activity, smoking, and occupations that require prolonged standing. Fortunately, lifestyle changes can make a meaningful difference. Walking activates your calf muscles, which act like a natural pump to help move blood back toward the heart. Regular physical activity, maintaining a healthy weight, avoiding smoking, and elevating your legs when resting may all help improve circulation. Some people also benefit from compression stockings prescribed or recommended by their healthcare provider. In the next part of this video, we'll cover 4 more important causes of ankle swelling, including pregnancy, medication side effects, and serious medical conditions involving the heart, kidneys, and liver. We'll also discuss the best home remedies, foods that may help reduce swelling, prevention tips, and the warning signs that should never be ignored. Pregnancy is one of the most common reasons women experience swollen ankles and feet, especially during the 2nd and 3rd trimesters. As your baby grows, your body naturally produces more blood and body fluids to support the pregnancy. At the same time, the growing uterus puts pressure on the veins that carry blood from your legs back to your heart. This slows circulation and allows fluid to collect in your lower legs and ankles. Hormonal changes also play a role. Pregnancy hormones relax blood vessel walls, making it easier for fluid to leak into nearby tissues. For most pregnant women, mild swelling in both ankles is completely normal, especially after standing for long periods or during hot weather. There are several simple ways to reduce pregnancy-related swelling. Avoid standing for long periods without taking breaks. Whenever possible, elevate your feet on a pillow while resting. Sleep on your left side if your healthcare provider recommends it, as this may reduce pressure on major blood vessels. Drink plenty of water throughout the day. Although it sounds surprising, staying hydrated helps your body regulate fluid balance more effectively. Wear comfortable shoes that provide good support, and engage in light physical activity, such as walking if your healthcare provider approves. However, it's important to know that not all swelling during pregnancy is harmless. If swelling appears suddenly, becomes severe, affects your face or hands, or is accompanied by severe headaches, blurred vision, upper abdominal pain, or high blood pressure, seek medical care immediately. These symptoms may indicate preeclampsia, a serious pregnancy complication that requires urgent evaluation. Sometimes swollen ankles are not caused by your legs at all. Instead, they can be a sign that another organ in your body isn't functioning properly. Let's start with the heart. Your heart acts like a pump that circulates blood throughout your body. If the heart becomes weaker and cannot pump blood efficiently, fluid begins backing up in the veins. This increased pressure causes fluid to leak into surrounding tissues, especially in the feet and ankles, because gravity pulls fluid downward. People with heart-related swelling may also experience shortness of breath, fatigue, difficulty exercising. Rapid weight gain over several days, swelling in both legs, kidney disease can also cause ankle swelling. Healthy kidneys remove excess water and waste from your bloodstream. When kidney function declines, your body may retain both salt and water, leading to swelling in the ankles, feet, hands, or around the eyes. Liver disease is another possible cause. The liver produces proteins that help keep fluid inside blood vessels. If the liver is damaged, protein levels may fall, allowing fluid to escape into surrounding tissues. These medical conditions usually do not cause ankle swelling alone. They are often accompanied by other symptoms, which is why persistent swelling should always be evaluated by a healthcare professional. If your swelling lasts for several days, keeps returning, or gradually worsens, don't simply ignore it. Early diagnosis often leads to better treatment outcomes. Many people are surprised to learn that ankle swelling can be a side effect of medications. Several commonly prescribed medicines may cause your body to retain fluid. Examples include certain medications used to treat high blood pressure, corticosteroids, hormone therapies containing estrogen, some medications used for diabetes, and certain anti-inflammatory drugs. If you recently started a new medication and notice swelling afterward, don't stop taking it on your own. Instead, contact the healthcare provider who prescribed it. In many cases, the medication can be adjusted, the dose changed, or an alternative prescribed. Never discontinue prescription medication without professional medical advice. Carrying extra body weight places additional pressure on your joints, muscles, veins, and lymphatic system. Over time, this extra pressure can slow circulation and make it easier for fluid to collect around the ankles. Obesity also increases the risk of conditions such as diabetes, high blood pressure, heart disease, and poor circulation, all of which may contribute to swelling. The encouraging news is that even modest weight loss can improve circulation and reduce stress on your lower legs. Research shows that regular physical activity combined with healthy eating benefits not only ankle swelling, but also overall cardiovascular health. Remember, weight loss is a gradual journey. Small, sustainable lifestyle changes are much more effective than crash diets. Now that we've discussed the common causes, let's look at practical steps that may help reduce swelling. The first, and perhaps simplest method, is elevating your feet. When resting, place your legs on pillows so that your ankles are slightly above the level of your heart. This helps gravity move excess fluid back toward your body's circulation. Another important habit is regular movement. If your job requires sitting or standing for long periods, take a short walk every hour. Even a few minutes of movement can improve blood flow. Simple ankle exercises can also help. Rotate your ankles in slow circles. Point your toes forward and then pull them back toward your body. Repeat these movements several times throughout the day. These exercises activate the calf muscles, which assist in pumping blood back toward your heart. Compression stockings may also be helpful for some people. These specially designed socks apply gentle pressure to the legs, helping prevent fluid from pooling around the ankles. However, they are not suitable for everyone, so ask your healthcare provider before using them, especially if you have circulation disorders. Maintaining a healthy body weight also reduces stress on your legs. Regular walking, swimming, cycling, and other low-impact activities improve circulation while strengthening muscles. Hydration is equally important. Many people mistakenly believe they should drink less water when they're swollen. In reality, dehydration often causes your body to retain even more fluid. Aim to drink adequate water throughout the day unless your doctor has advised you to restrict fluids because of a medical condition. Although no single food can cure ankle swelling, a healthy diet supports your body's natural fluid balance. Choose foods naturally rich in potassium because potassium helps balance sodium levels. Good choices include bananas, sweet potatoes, spinach, avocados, oranges, tomatoes, beans, yogurt fresh. Fruits and vegetables also provide antioxidants that support overall health. Water-rich foods such as watermelon, cucumbers, strawberries, celery, and lettuce can contribute to hydration. Try to reduce processed foods that contain large amounts of sodium. Read nutrition labels carefully. Many canned soups, frozen dinners, packaged snacks, sauces, and fast foods contain much more sodium than people realize. Preparing more meals at home allows you to control the amount of salt you consume. Let's clear up a few common misconceptions. Myth number 1, swollen ankles are always caused by drinking too much water. False. Most swelling is actually related to fluid regulation, circulation, medications, or underlying health conditions, not simply drinking water. Myth number 2, swelling is always harmless. Also false. While many cases are temporary, persistent, or sudden swelling should never be ignored because it can sometimes signal serious disease. Myth number 3, only older adults get swollen ankles. Not true. Pregnant women, athletes, office workers, travelers, and younger adults can all experience ankle swelling for different reasons. When should you see a doctor? Knowing when to seek medical care is one of the most important parts of this discussion. Contact your healthcare provider if swelling lasts longer than a few days. It continues to return without an obvious reason. One ankle is significantly more swollen than the other. The swelling becomes progressively worse. You develop redness, warmth, or increasing pain. You have diabetes, kidney disease, heart disease, or liver disease and notice new swelling. Seek emergency medical care immediately if ankle swelling is accompanied by chest pain, difficulty breathing, sudden severe swelling in one leg, severe pain after an injury, inability to walk after an accident, fainting, or confusion. These symptoms may indicate a serious medical emergency requiring immediate treatment. Ankle swelling is extremely common, and in many cases it results from everyday factors like standing too long, eating excessive salt, minor injuries, pregnancy, or reduced circulation. Fortunately, many of these causes improve with healthy lifestyle habits such as regular movement, reducing sodium intake, staying hydrated, elevating your legs, and maintaining a healthy weight. However, persistent, worsening, or sudden swelling should never be ignored. Your ankles can sometimes provide important clues about your overall health, including possible problems involving your heart, kidneys, liver, or blood circulation. Listening to your body and seeking medical advice when symptoms don't improve is one of the best steps you can take to protect your long-term health. If you found this video helpful, please give it a thumbs up and share it with friends or family who may benefit from this information. Don't forget to subscribe to the channel and turn on notifications for more evidence-based health videos designed to help you live a healthier, happier life. Thank you so much for watching, and I'll see you in the next video. Stay healthy and take care.